After more than 2 years, India's COVID-19 battle seems to be under control. Both daily caseload and deaths are falling every day. But the focus on COVID had affected other public health missions, like tuberculosis, for example. Now, with the COVID-19 pandemic in the side mirror, India is back to tackling tuberculosis. We get you up to speed with the campaign.
Street dramas like this one are extremely popular in India. They use a set pattern, music, posters and an important message.
अगर जांच करने के बाद आपको पता चलता है कि आपको सादे वाला टीबी है.
This one is talking about tuberculosis, what many doctors call the silent killer. India is home to a quarter of the world's TB infections. In 2020, 500,000 Indians died from it. That's around 1/3 of the global toll. COVID-19 made matters worse.
The symptoms for COVID as well as the symptoms for TB are the same. So we started realizing that people are not coming forward for TB testing only because of the scare of doctors asking them to get COVID testing. And then if they turn out to be positive, they are into the quarantine. So that was the real issue because of which they never come forward.
Missing cases, that's the issue here. Around 2/3 of TB patients never seek treatment. Before 2020, tuberculosis was the deadliest infection in the world. Then came COVID-19. Initially, it was considered to be a death sentence. So many patients resisted the urge to get tested.
Since I've been going through it, I want to encourage the people who are suffering from tuberculosis and give them support. I want to tell them if I can recover, then why can't you?
Things got worse in 2021. India was swept by a second wave of COVID-19. State resources were diverted to contain this surge. The result? Tuberculosis was again on the back burner. This put India's long-term targets in jeopardy.
In 2018, the Prime Minister of India gave a clarion call to meet Sustainable Development Goals 5 years ahead of 2030 target, 2025. COVID for 2 years did bring some setback on ground, but at the same time, the policymakers and the program implementers are still sticking to 2025 targets. And they are doing catch-up campaigns. So there are active case-finding campaigns in the community.
But it's not all bad news. India has finally tamed the COVID-19 pandemic. Both daily cases and deaths are falling every day. So now policymakers are recalibrating their approach. Once again, TB is on the radar. Only grassroots campaigns can find the missing TB cases. And all of this needs funding. It needs political will from the Western world. We saw how quickly the COVID vaccine was developed and produced. Something similar needs to happen with tuberculosis. South Asia Bureau, WION World is one.